Let us talk about Gaucher's disease. It is a lysosomal storage disorder, autosomal recessive type. Here, the mutation occurs in the gene encoding glucocerebrositases, leading to the deficiency of this particular enzyme. Further leads to the accumulation of glucocerebrosites in the lysosomal macrophage. Here the pathological changes are due to accumulation of glucocerebrosites in the macrophages and also due to the activation of this macrophages because of this accumulation, right? So macrophageal activation releases interleukin 1, 6 and TNF, and there are three types of Gaucher's disease. Type 1 is non-neurogenic. Most common, 99% of the cases, no involvement of the CNS is seen as it is non-neurogenic, and accumulation of this glucocerebrosites is usually occurs in bone, liver or spleen. In spleen and liver leading to hepatosplenomegaly, and in bone it leads to osteopenia or osteonecrosis. Type 2, it is the very severe form. The prognosis is not at all good. It's an acute neuropathic type. It occurs in infants. There will be an involvement of CNS and mental deterioration is seen, cerebral dysfunction, convolutions. And type 3, it occurs in child and it is less severe compared to type 2. So the prognosis is slightly better. CNS is involved, convolutions, mental deterioration, cerebral dysfunction. Diagnosis is by microscopical findings of Gaucher cells in the bone marrow. So when you take the sample of this bone marrow, you can find Gaucher cells in the patient with Gaucher's disease. Also check for acid beta glucosidase in the WBC, and genetic testing is preferred nowadays. And Gaucher cells, these are the enlarged phagocytic cells with the accumulations of glucocerebrosites, interleukin 1, interleukin 6, TNF. Accumulation of glucocerebrosites is because of the deficiency of the enzyme glucocerebrosidase, right? Because of the deficiency, there will be an increased accumulation of glucocerebrosites. And this interleukin 1, 6 and TNF is because of the macrophageal activation. The fibrillary type of cytoplasm is seen here. That means it gives a wrinkled paper appearance and one dark eccentric nucleus is present. These cells are accumulated in spleen, liver, bone marrow, tonsils, thymus, Peyer's patches, etc. And the people with the Gaucher's disease have high risk of Parkinsonism. These are the Gaucher cells. Wrinkled paper appearance, cytoplasm, and the nucleus is eccentric and dark. And the rest of the cells which you can see here are the plasma cells. And treatment. Coming to treatment, the main problem with this disease is an enzyme, right? So we'll replace that enzyme replacement theory for 1 and 3, as we know about 2. Type 2 occurs in infants and it is the severe form, and usually the infants gonna die. And another cases, you can give the patient a corrected enzyme, right? So for this we use gene therapy, transplant of hematopoietic stem cells which can produce corrected enzyme. So the first one is enzyme replacement therapy, and the second one is giving corrected enzyme. That means gene therapy, transplant of hematopoietic stem cells with corrected enzyme. And the third one is splenectomy. It is done in the cases with splenomegaly, where the spleen enlarges severely and there will be an increase in its weight to 10 kgs. Medicines and injections are given. Substrate reduction therapy. There will be an oral intake of inhibitors of glucoceramide synthase enzyme. So this is about Gaucher cells.